What are common questions that you get from families?
Some of the most common questions patients will ask during their clinic visits to the Vascular Anomaly Center, some of these questions are almost repeated by most of the families. They include, is it genetic? Is it something that was done during the pregnancy? Is it related to any factor that that the child has to go through at any stage of life? Is it a tumor? If it's not a tumor, then why it was managed as a tumor? The different types of malformations in the patient may require different explanations. So combination of malformations, especially in some syndromic patients, require also different explanation of these different types. So families will always ask about the approach to different types of or different components of the disease. Some of those components could be vascular, some other components are not vascular. So some of the common questions also is, will any intervention that will perform in the blood vessels completely get rid of the malformation? Some of the times, or many of the times, that's not applicable, which means that the malformation is mixed with some other tissue, and addressing the vascular anomaly alone is not going to address the entire malformation. So the combination of the treatment is often an interesting question, is why we need to combine different forms of treatment. Why don't we just perform one form of treatment instead of combining too many of those? How many treatments I have to go through? How long is the recovery unit? What is the outcome? And for these uncommon diseases with little characterization in the literature in regard to their outcome of treatment, the questions could be a little challenging. And patients have different burden of the disease, different volume of the malformation, different organs involved, and sometimes providing very definitive answers. We always seek definitive answers. Sometimes these definitive answers are not easy to directly address by just giving a number or speculating on the percentage of response to the treatment. We often tell families that the treatment itself could be lengthy and it may require more than one intervention. And unless we get to the point where both the family and the physician are on the same page regarding the length of the treatment, the type of the treatment, and the commitment between the physician and the family or the patient to continue with the treatment, we typically do not initiate the treatment before that is already secured.